Good morning, everybody. It is just about 10 o'clock, so we're going to wait about one more minute here, as I do see there are some people still logging on. So about 60 seconds, we'll go ahead and kick this thing off and get started. All righty, let's go ahead and get this thing started here. Good morning, everybody. This is Tyler Finken, Health Marketing Director over at Western Marketing. I just want to say thank you for taking time out of your busy schedules to join us on the Ameritas Dental and Vision webinar this morning. Today with us, we have Mr. Todd Cowan with Ameritas. He's going to be going over a couple things here. A couple of things I do want to mention before we go ahead and get started here. This is going to be a jam-packed webinar today. Mr. Cowan does have lots of really good information about their current products, as well as some really cool stuff that's coming down the pipeline here with Ameritas. So really excited to inform everybody about that. I do want to mention that there on the right-hand side of your screen there, you should see a box, and about 3/4 of the way down, there's a box there that you can click on that says questions. If you do have any questions throughout the webinar, please feel free to type them in there, and at the end of the webinar, Todd and I will take a few minutes to go ahead and answer those questions. So like I said, Todd Cowan with Ameritas is with us today. Todd, thank you for taking time out of your day to be with us, and whenever you're ready, I'll kick it over to you.
Great. Thank you, Tyler. Can you hear me okay?
Yep, I can hear you loud and clear, buddy.
All right, perfect. Excellent. Well, again, I want to thank you very much, Western Marketing, for coordinating this webinar. We certainly appreciate your partnership. We've had a relationship with Western for many years, and so we're looking to continue to grow the business together. So thank you very much for that. I also want to thank everyone who took time out of their busy day to join me. I know this is a busy time for everyone. As Tyler said, we're going to talk a little bit about our plan designs, that our most popular plan designs that we're selling today. We'll touch base on our network and some of the growth and where we stand as it relates to the size and discounts around our network. Then I'm going to share some best practices as it relates to cross-selling and how to cross-sell dental into your traditional Medicare sales. And then lastly, as Tyler mentioned, we're going to talk about some coming attractions, some things to look out for with our new enrollment tool that's going to be launching here in a week. On the 25th of March, you'll see a new enrollment tool, as well as I'll give you some early thoughts around our plan designs that will be rolling out over the summer, some of the enhancements based on your feedback. So with that, let's jump in. We're going to talk about why dental and vision. As you'd imagine, a carrier like Ameritas does a lot of market research, not only with consumers and members that are purchasing our plan, but also with agents and our distribution partners that are representing Ameritas. And so when we talk to our highest performing agents and we talk about what are their best practices and why do they include dental and vision in their product portfolio, a couple thoughts that jumped off the page at us. First, these are products that can be sold all year long. We're not limited to either an under 65 enrollment period or an AEP period to market our plans. They can be sold all year long, and from a best practices perspective, what most agents are doing is using this time right now in the off season, to establish those relationships with consumers that are potentially aging into Medicare eligibilities. They're using a dental and vision product to establish that relationship. They know it's in high demand, and we're going to talk about consumer demand a little bit later on in the presentation. But they're using dental and vision as that door opener, establish that relationship with their client, and then during open enrollment periods, they're able to leverage that relationship and cross-sell into either an MA plan, a MedSup, or and make it part of their traditional Medicare conversations. Consumer demand. We'll talk a little bit about the consumer demand. As I said, we've got data that shows us that 71% of Americans that are covered with dental insurance today and are plan on purchasing a dental product when they age into Medicare eligibility. 71% of Americans that are aging into Medicare eligibility plan on purchasing a dental product for their retirement. So we'll talk a little bit about how Ameritas could potentially help capitalize on that consumer demand. Growth in your commissions, that's pretty straightforward. Being able to use dental and vision as a nice way to grow your business. And then one-stop shop. The feedback we received from our top performers is really the importance of remaining relevant, making sure that you've got products to fit all the needs and potentially cover the gaps in traditional Medicare. Our data tells us that consumers are going to purchase dental when they retire, and it's just important to Ameritas that we give you the products to fill that gap in traditional Medicare and make sure they're purchasing the dental products from you and not going to another agent. So those are some of the best practices that we see when we talk to our top performing agents across the country. So that's kind of the why dental is important. Let's talk a little bit about why Ameritas is a dental carrier of choice in the senior market. We've got a very simple go-to-market strategy, and it really consists of product simplicity, economic value, and ease of enrollment. It's those three pillars that we use that guide all of our go-to-market strategies. Product simplicity. We try to keep our products as consistent as we possibly can across the country. We know there are some state variations based on DOIs, but making our products very simple and easy to understand makes it easy for you as the agent to explain to the consumer, and it also makes it easier for the consumers to understand. We don't have any gotchas in our contract. We don't have any waiting periods in our contract. So we try to keep our products as simple as we can. Economic value is our second pillar. Our second go-to-market strategy is economic value. What we mean by this, said a different way, is people purchase auto insurance and homeowners insurance with the hopes that they'll never have to use those coverages. People purchase dental insurance because they know they're going to use it. They know they're going to need it. And so because of that, we make sure we don't have any waiting periods on any of our covered benefits. We give people the ability to have next day coverage. You can enroll your client today and they can go and see the dentist tomorrow. We believe that creates value for your member. We offer coverage for crowns, dentures, bridges. Based on our data, these are the types of benefits that consumers want. So again, creating that economic value is the second pillar of our go-to-market strategy. The last is ease of enrollment. I'll show you a couple of screenshots on our enrollment tool. But again, we've got a brand new enrollment tool that's rolling out at the end of this month on the 25th. For those of you that currently have a link that you're using the enrollment tool today with Ameritas, you don't have to do anything. Your link will redirect on the 25th to the new enrollment tool. The goal of the new enrollment tool is to capitalize and to enhance what we have today, making sure that you can enroll your member in 3 to 5 minutes or less. Making sure that it's intuitive enough that you can send your link to the consumer and they can self-serve and enroll by themselves without you being involved in the process. So again, product simplicity, economic value, and ease of enrollment are the three go-to-market strategies for Ameritas. The other important thing on this point is Ameritas is not new to the individual dental business. We've been in the individual senior dental business for over 30 years. We've got over a $300 million in-force book of business. And why is this important? We do a lot of market research on consumer behavior, on what they're purchasing, why they're purchasing it, and how they use our plans. And so what that creates is stability in our product. We don't go out with a benefit that we know is too rich and will ultimately blow up at the end. We'll ultimately have to give massive rate increases to keep the program viable. We've got very consistent plan design, very consistent service delivery, and very consistent renewals. So that's why we believe that it's important to do business with a company who's not a newcomer to the individual dental market, who's got some experience and has some tenure. And Ameritas has been doing it for over 30 years. The last item on this slide is we're not a medical carrier that, oh yeah, by the way, as a sideline, we sell dental. This is not a hobby for us. We focus on dental and vision. It's what we do. And so we believe that having laser focus creates some expertise and thought leadership in the business because it's our core, it's our primary business. So that's a little bit about why we believe Ameritas is a good choice for your senior dental product needs. Let's go to pillar number 1. We talked about product simplicity. Keep it simple. You can see everywhere in green, we have consistent plan designs. So therefore, for those brokers on the phone that are marketing products in multiple states, there's no need for you to remember different products by different states. Everywhere in green has the same plan designs. I do have some uniquenesses in Illinois and Texas. And then, of course, you can see those that are in gray. I do, in fact, have product there. I've got dental product in every state of the country. But because those states have a challenging DOI, I do have a unique product in those states. The most important thing to remember on this slide is, again, consistency in the product, but 2, you don't have to remember what plans are available in your state. The quoting engine, the enrollment tool is intuitive enough. As soon as you put the member's zip code in, it's going to bring back the plans that are available in that state. So again, product simplicity is an important part of the Ameritas go-to-market strategy. Here's a little bit about our market research. Again, as you'd expect, Ameritas does a lot of market research in the senior space. A couple of things that I think are intuitive, but one's a little bit of an aha moment. Our senior, based on our book of business and based on our research, seniors are 2.5 times more likely to have a crown. They're 4 times the cost of dentures versus the under 65. This last bullet, I think, is a little bit of an aha moment. What we hear a lot from our agents is my consumers can afford to self-insure for preventative. They really only want coverage for the high dollar items like crowns and dentures. That's not true. Our data tells us and our market research tells us that senior consumers find preventative benefits equally as important as under 65. So an interesting kind of market dynamic there with our seniors. Prime Star Protect. We rolled this product out in late 2019, and then we rolled out a few more states in mid 2020. This is our number 1 selling product. We sell roughly 75% of our business on this plan design. You can see running down the left-hand side, preventative, basic, major, and we do have our deductibles and our annual max benefits. Preventative, 2 cleanings per year. Day 1 coverage, again, no waiting period. Going back to our economic value discussion earlier, there's no waiting period on any of the benefits, and a member can have their coverage start the next day. Enroll them today. They can go and get their cleaning tomorrow. Basic services, filling, simple extractions, 65% coverage day 1. Tomorrow, when you enroll your member and they start tomorrow, 65% coverage day 1, and that increases over time to 80%. Again, the story here is we like to reward our members the longer they stay with us. We like to increase their benefits over time. Major services, implants, perio-endo, dentures, root canals, you can see start at 20% on day 1, and it increases to 50% over time. Orthodontics, this product is in fact available from 18 years and above. So in the event that you do sell someone that's the under 65 market, we do have orthodontia that's automatically included. And then you can see a deductible of $50. We do give members the choice They can either choose to have $1,000 or a $2,000 annual max. Roughly 60% of our business is sold in the $2,000 annual max. So I want to go back up to the major services. We did add dentures about a year and a half, about 2 years ago, roughly. And as everyone knows, on this call, there are three important things that are not covered under traditional Medicare. The first is dental under traditional Medicare. The first is dental. The second is dentures. And the third is vision. So again, we want to make sure that you're leveraging the Ameritas plan to fill those gaps in traditional Medicare. Let's talk about some member flexibility. That Protect plan that we just went over is our #1 selling plan. Consumers can choose to purchase that plan either on a MAC basis or what we call a usual and customary, or a UNC basis. What that means, to be very specific on that, what that means is if one of your members chooses to purchase that Protect plan on a MAC basis, that means when they go in network, they get the value, the discounts of the negotiated rate that Ameritas has negotiated with our providers. If they go out of network, the claims reimbursement will be based off of what we call the maximum allowable charge, or the lowest discount in that area. If a member chooses to purchase the plan on a UNC basis, that means when they go in network, they get the value of our negotiated rates, just like the network plan. However, if they go out of network, they will base our claims reimbursement based on the 80th UNC, what 8 out of 10 providers charge for that particular claim in that zip code. So let's say that a little bit differently. If your client's dentist is in the Ameritas network, and I'm going to show you in a second how to figure that out. If your client's dentist is in the Ameritas network, they should absolutely choose the network plan. The premiums are anywhere from 15 to 20% cheaper, and they get the value of those negotiated rates. If your client feels they're going to visit a provider that's not in the Ameritas network, that's outside the Ameritas network, I would recommend that they choose the plan that's on the 80th UNC. It's a little bit higher priced because they get the choice to see any provider in the country. So again, just a little bit of a choice for our consumers. I do want to call out fairhealthconsumer.org. This is not an Ameritas site. Just a nice tool, I think, for agents to keep in their hip pocket. This is an independent research firm, Fair Health Consumer. And what this site will allow you to do is to enter in a zip code, enter in a particular procedure, and it will tell you how much a filling is in St. Paul, Minnesota, or how much a filling is in Missouri Valley. So you can put in the zip code in the procedure, and it will tell you what 8 out of 10 dentists charge for that particular zip code in that area. So again, not an Ameritas tool, but a nice helpful hint, or a nice helpful resource there. Let's go down the path of why networks are important. Again, we talked about network. If one of your members chooses my network plan, the premiums are lower. Premiums are lower because of the negotiated rates that Ameritas has with our providers. And our negotiated rates are anywhere from 20 to 50% off of billed charges. No balance billing. When a member seeks a dental service inside the Ameritas network, those dentists are contractually obligated to only bill the contracted rate. They cannot bill above the contracted rate. There's no balanced billing, no surprises. Your member will not get any surprises 2 weeks later from a dentist with a giant bill. So again, no balance billing. And then of course, no claim forms. When they go in network, the dentist will submit the claims electronically. Let's talk about the size of the Ameritas network. We are very proud of our network and excited to say that the network has grown over 70,000 access points over the last 12 months. We've got a dedicated team of folks in Lincoln that go out into the market and recruit providers for us. So it's a major focus for us to continue to grow the network. We're excited to say that we've got over 585,000 access points across the country with over 130,000 unique providers. So just to be clear, because as you're comparing dental plans and as you read marketing materials from carriers out in the market, we just want to make sure that we're level setting and we're comparing plans apples to apples. An access point is a unique brick and mortar location up and down Main Street where an Ameritas member can go and seek dental services. A unique provider is just that. It's a unique dentist that is working and provides services within those access points. So again, just want to make sure that we're using the proper terminology and that everyone kind of understands how Ameritas measures our network. So we talked about the go-to-market strategy, going back to the product simplicity, economic value with no waiting periods, and ease of enrollment. This slide gives a quick illustration of how we combine our product simplicity as well as our economic value with no waiting period. So we'll go quickly and use the example of a crown. An uninsured person goes into a dentist's office, and that dentist tells the uninsured person that they need to get a crown. The average price of that crown is $1,337. You sell that member an Ameritas dental plan today. They go back into an Ameritas network provider, and just because they are now enrolled in Ameritas, they get the value of the discount. So the $1,337 is reduced down to $819. That's the negotiated rate that provider has negotiated with Ameritas. So $1,337 drops down to $819. Then we need to layer in my day one benefit. The day one benefits on the Protect plan, no waiting period, next day effective dates, day one benefits are 20%. So within 24 hours, you've taken your client who was uninsured, who needed a crown, and instead of paying $1,337, within 24 hours, you've saved that member $682. We call that creating $682 of economic value. Over time, you can see that our benefits increase from a 20% coinsurance level, 20% coverage on day one, and then after 12 months, it increases to 50%. So you can see how that increases, and now you've saved them $972. So again, just a simple illustration on creating economic value. So we talked about our number one selling product. We talked about our go-to-market strategy, some of the coverage and the benefit levels. Want to talk a little bit about best practices as we, again, work with our top performing agents across the country, and how do they start that conversation? What are those best practices? How do they cross-sell a standalone dental plan into a traditional Medicare Advantage, into a traditional Medicare sale? First is a scope of appointment form. I know it sounds simple. I know it sounds simple to everyone on this call, but the beauty is in the simplicity. The idea here is let's let compliance be our friend. Making sure that you've got the proper scope of appointment form. Your scope of appointment form outlines that you're going to be speaking to your client about dental and vision. Does a couple things. First, it makes sure that you're in compliance, right? And that's important for everyone to make sure that we're compliant. Secondly, it sets the expectation with your client that you recognize there's a gap in traditional Medicare, the gap of dental, dentures, and vision in traditional Medicare, and that you view dental and vision as an important part of the overall wellness of your client. So when you do that, you set that expectation with your client at the onset. It makes that transition into the dental conversation much easier. The next is pure education. Everyone's familiar with the Medicare guidebook, Medicare and You guidebook, page number 49, what's covered. Simply educating your clients, dental, dentures, and vision are not covered under traditional Medicare will help start the conversation. What are some quick conversation starters? Being very simple. Asking your client, do they currently have dental insurance? Again, going back to our data shows us as we do research and we work with the Gallup folks to help us with the research. 71% of those folks that have dental today and are aging into Medicare eligibility plan on purchasing dental in their post-retirement years. Next is, how do you plan on paying for your dental expenses? Asking your client how they plan on paying for their dental expenses. Our data tells us that the average senior spends over $1,100 in dental expenses a year. These are dental expenses that are likely not accounted for. Your senior has gone through great lengths to manage their expenses around what they're going to pay on medical, housing, auto, all the other expenses that they have in their life. Oftentimes, their dental expenses are overlooked. So you know your senior is going to spend $1,100 a year in dental. When we look at the Ameritas book of business, what we save our members, our senior members, is about 32% on that $1,100. So again, going back to creating that economic value, saving your seniors money on expenses you know they're going to incur. The next is, did you know traditional Medicare, what it does and does not cover? Ameritas offers standalone dental to fill the gaps in traditional Medicare. This includes next day effective dates and no waiting period. No waiting period. The other item that's not on this page that I think it's important for everyone to understand the value of a standalone dental plan. Many Medicare Advantage plans today offer some level of dental benefit. I'm sure everyone on this call has seen the advertisements and has seen those plans. The importance of, or the value of selling a standalone dental plan is that we do not coordinate benefits with any other other dental plan. So what that means is, if your member has a small benefit on their Medicare Advantage plan, great. Let them take advantage of that. That's fine. That benefit that they receive from that medical carrier that has a little dental benefit in it does not impact their Ameritas benefit at all. Ameritas will always pay as the primary carrier. So the Ameritas plan doesn't coordinate with them. So I think it's important. It's important for you to remember the value of a standalone a standalone dental plan. VSP. So again, we talked about the dental plan a lot. We're going to transition a little bit into our vision plan. There are two things to keep in mind with our vision benefit. First, Ameritas is the only vision carrier that offers two different networks. I've got a plan with IMED and I've got a plan with VSP. That's the first thing to remember. Second, our vision plans can be sold in combination as a bundle with the dental, or they can be sold standalone. You can sell standalone vision if you like. So those are two important differentiators. Let's go quickly into the vision. We talked about why dental. Let's talk about why vision. Industry data tells us that folks that are visually impaired increase the risk of falls and fractures, increase the risk of depression, increase the risks of ADL, or creates difficulty around those ADLs with activities of daily living. For these reasons, that's why Ameritas feels that vision coverage, vision benefits are an important part of the overall wellness of our senior members, of all of our members, but in particular our senior members. That's why we give vision equal importance with our dental plan. We've got two plans, one with IMED, one with VSP. When we look at what we sell, it's right down the center. About 50% of the time we sell the IMED, 50% of the time we sell the VSP. You can see the network retailers with the IMED, Pearl Vision, as well as the Target Optical. The IMED plan is designed a little bit more towards that value buyer, somebody who may be a little bit more focused on price. So when we take a look at the benefits here very quickly, eye exams are at $25, contact frames and fittings are at $15, and you've got a $130 frame allowance. Very comprehensive vision plan, very straightforward, easy to understand. Frequencies, we call this one a 12-24-24. Eye exam every 12 months, eyeglasses every 24, and frames every 24. Look at the rates, $11 for a single, $10.67. Very straightforward program for less than $11. Rates are not based on geography, with the exception of these 3 states. They're not based on geography. They're not based on age. Switching over to the VSP, this plan is focused a little bit on the higher end of the market, folks that are looking for a little bit more benefit-rich product. You can see the eye exam drops. It was $25. Now it's down to $10. Frames was a $130 allowance. Now it increases up to $150. Frequency. The frequencies were 12-24-24. Now it's 12-12-12. So more frequent. Members can receive benefits more frequently. As the benefits increase, you can see the price increases from $10. It floats up to $16. So a little bit more expensive on this plan. So again, these products can be, so let's do a quick economic value. Similar illustration to our dental economic value. I won't, you'll get the theme here, so I'll go very quickly. An uninsured member wants to get some eyeglasses, and they walk into an eye doctor, and that eye doctor to get an exam and the eyeglasses will cost that member $515. That uninsured member, you sell them an IMED plan. The next day, they go back in to get their eyeglasses, and you can see the exam cost is $25, and you can see the frames discounts and the lenses. So the total out of pocket is $130. I've even added the annual premium, full annual premium for 12 months. So within 24 hours, you've saved that member $257. You've created $257 of economic value. So again, just an illustration on how our plan designs and our no waiting periods and next day effective dates create that value. We'll go quickly through the enrollment process. For those folks that are brand new to Ameritas, if you have not sold Ameritas in the past, we can work with the folks at Western Marketing to make sure you get appointed and you get your enrollment link. This enrollment link is what you use to help your members shop, compare, and enroll in coverage, or you can send that link to your member and they can enroll themselves. It's important that you don't share links with other people. When we create a link for you, it is uniquely yours. That's how we track all of your production. In the event that you use someone else, another agent's link, they will get credit for that production. So please don't share your links. In addition, this is a straight-through process. What we mean by that is we do not have a paper option. When you or your member enrolls through the link, it's uploaded into my billing system through a batch process at midnight that night, and your member can go and seek the dentist tomorrow. At no point in the process does a human being ever touch your application. So what this means is speed to enroll, and it's fully scalable. There are no delays during open enrollment time frame. There's no slowdowns as an underwriter works your case. This, again, is straight through processing. We'll go very quickly on this quoting engine. You can see we require minimal information to generate a proposal or generate a rate, zip code, who wants to get coverage, are you looking for dental or vision, who's going to be coverage. I have 3 tiers, single, single plus 1, or full family. And then coverage can start as soon as today, as soon as tomorrow, and as far out as 90 days. Based on the information that's entered, the plans that are available in that state will return. We also have the opportunity for folks to search out a network provider. You can see the link there where they can search on the network provider. If they port out to that network, to my network portal, they can search providers by city, county, zip. We also have some additional filters that they can search by, whether they want someone that speaks a particular language or a particular specialty. They can also search by that. Here's what we'll return: all the providers that are in that area. You can see most of the providers are in black font. We will show that some that are in green font. The important thing to remember, those folks that are in green font, those providers have agreed to our deepest negotiated rates. So what this means, said a different way, if your member does not have a dentist today, or they're open to changing dentists, the dentists that are highlighted in green have agreed to the deepest discounts in that zip code, and therefore they will save your clients the most money and create more economic value. So again, it's just a way for us to create steerage and help your clients save more money on their dental spend. After you submit the policy, that policy again is uploaded into my system through a batch process. You will receive a welcome email, as well as your policyholder will receive a welcome email. And then the certificate and ID cards will be mailed within 7 to 10 business days. So again, very, very quickly, what's in it for the agent? Ability to sell 12 months out of the year, remaining relevant, being that one-stop shop, helping your persistency. We've got data that shows us that folks that have multiple products with a particular agent will persist longer than those folks that only purchase one product, and then adding value. The last thing, what's new in 2021? So let's talk about some good things that are on the near-term horizon. Our new shopping and enrollment tool will launch on 3/25. All of the things so let's talk about what that means. For those folks that have a link, again, you don't need to do anything. On the 25th of this month, the link that you are going to be redirected when you use your existing link, you will be redirected to the new enrollment site. The workflow is going to flow very similar to what I just showed you. Very minimal information to generate a rate, easy to enroll. It's just the user experience is going to be much smoother. It's going to be more contemporary and a nicer process than we have today. So again, the enrollment tool is coming. New products. My new plans are going to be rolling out at the end of the summer. They're currently being filed. While I can't give you the specifics on those plans, let me give you a few hints on the products that what you're going to see. You'll see higher annual maxes for our products. You'll see us add a hearing benefit. You'll see us add LASIK coverage and a couple of other fun benefits. So again, higher annual maxes. You'll see us add a hearing benefit to our senior product, and you'll see us add coverage for LASIK. So some exciting things coming down the pike. Again, I can't divulge too much here. We're currently in the filing process, but good things are coming later on the year. And then the last item is producer back office. We heard you loud and clear, the need to have a website, be able to manage your book of business, look at your in-force clients, do some self-service tools like order ID cards and policy booklets and things like that. This will be coming before the end of the year. It's likely going to be at the very end of the year. We do not want to interrupt and disrupt any sort of open enrollment activity. So look for this one very late at the end of this year. We appreciate your patience on this one. This one was a heavy lift, a heavy build for us. So producer back office is coming. And from a next steps perspective, if you're appointed with us and you're currently writing business, thank you very much. We appreciate your business. We're looking forward to writing more business with you in 2021. If you're not appointed to sell the Ameritas product, I encourage you to please contact your marketer at Western Marketing. They can help you. They will help you with all the appropriate paperwork and get you set up and get you selling the business, get you ready for open enrollment. So with that, Tyler, that's what I've got. I don't know if anyone has any questions. We can take them via chat.
Yeah, absolutely. Well, thank you so much, Todd. We certainly appreciate it again. That was an excellent, very, very informative webinar. Just to kind of piggyback off of Todd here, yes, for those of you that are already appointing and writing with us, we certainly appreciate your business. We had a personal record year with Ameritas last year. Actually blew our previous year out of the water. So we certainly appreciate everything you guys do for us. For those of you that are not appointed, I want you to take a notepad, write down this number real quick in case you don't have it. You can reach us at our office at 800-852-7152. Again, that's 800-852-7152. Feel free to ask for whoever your health marketer is, or if you don't have one already, just ask for a health marketer. We're all standing by, ready to help you. Now, before we do finish this up here, Todd, we do have a few questions I want to go over with you.
Sure, happy to do it.
All right. First question says, can we get the slides and the recording of this? This webinar was recorded, and Todd, with your permission, am I okay to send that out to the agents that were attending today?
Of course, absolutely.
Okay, sounds good. So you will all be receiving a link to the recording from me shortly after we wrap up here. Next question says, please send the slides. Okay, we just covered that one. Can we use the Ameritas logo in the plan with marketing via newsletters, agencies, and ads?
You can, with one caveat. I would ask you if you could just send that, if you plan on using the Ameritas logo, if you could send a sample of how you'd like to use it. If you want to use it on a newsletter, that's fine. If you could just put it on the newsletter and send it to your Western Marketing marketer, and they'll route it to Ameritas. And we've got roughly a 5 business day turnaround time on that. We just want to look at it just to make sure that it's compliant and that we're comfortable. Typically we're comfortable with how our logo is used, but we just want to do a quick little compliance check and make sure it's okay. We'll get back quickly with your with your marketer, and they can give you the update.
Okay, sounds good. Next question says, of all the dentists that come up in network, is it just the green fonts that have the best discounts?
It is. So all of the dentists have a discount just by being inside the Ameritas network. So the folks that are both in black font and green font all have a discounted or negotiated rate with Ameritas. The dentists that are highlighted in green will have the deepest discounts in that area. Now, that's somewhat confidential, so I can't share the exact discount, of course. That's between Ameritas and the dentist, but the green folks have the deepest discounts. I'm hoping that answered the question.
Okay. The next question is more of a comment. It just says the portal needs to allow agents to view individual active policies. That is one of the improvements that is being made to the back office coming later this year that Todd just touched on a little bit ago. So we'll go to the next one here. This one says, I do not yet offer Ameritas. What website can I go to see if I have contracted dentists in my area?
So you can go to Ameritas.com, and there is a provider search link on Ameritas.com, and it will allow you to do that provider search where you can search by city, state, zip code, etc. So again, there's a provider search button on Ameritas.com.
Yep, and I'll make sure to include a link to that in the email that we send out shortly here. That's also got like the recording and the product info, so you should have access to that. Next question is there credit for existing dental insurance?
We don't offer takeover or credit for existing insurance. We don't have any waiting periods on any of our benefits, and so therefore we don't necessarily go down the path of offering takeover benefits. We give everyone kind of that same level first day first dollar benefit, whether you have prior coverage or not. So no, we don't offer credit for prior coverage or takeover.
Okay. And looks like last question here, Todd. It says, are brochures available to distribute to consumers?
They are, yes. And we can make sure that your Western marketing marketer will have those brochures, and they can supply you with that information.
Okay. Well, that sounds good. That looks like that was the last question. So again, Todd, thank you so much for taking your time to put on this webinar with us today. We hope you all found it very, very informative. Again, if you are already contracted and writing, we're going to send you out a bunch of the updated info here. If you're not contracted, feel free to get a hold of us and your marketer as soon as possible. We'll go ahead and get you set up and ready to go so you can start writing this right away. I will be sending you out an email with the recorded webinar and a couple of links to like the provider network, product info, etc. So thanks again, everybody, for your time. We certainly appreciate it, and we look forward to working with each and every one of you continuing in 2021 here.
Thank you. Appreciate everyone's business. Thank you.
Bye-bye.
Goodbye.